Do you notice this right here? Do you know what it is? It's my thyroid. Well, actually, it's where my thyroid actually is. But if you have a nodule on your thyroid, it can actually look like this. Can you imagine? Look how big this is. This right here is a nodule. And believe it or not, it's more common than you think. I am with Dr. Richard Harding, and I'm at the Thyroid Nodule Treatment Center, where you do all kinds of treatments here. I know you also do surgery, right, when it comes to the thyroid, but you are very excited to tell us about a different type of procedure you're able to perform. What is it called?
So right now it's radiofrequency ablation.
Okay, which we hear that term a lot.
And it's a ultrasound guided treatment where we place a probe inside the nodule and under ultrasound very directed therapy to treat that nodule with a low grade of heat and destroy the nodule.
So let's talk about, first of all, who gets nodules? And because you told me they're very common.
Very common. More so in women than men.
Really?
But 50% of people at the age of 50 will have a thyroid nodule.
And it just continues to grow for some people?
Some patients will get it, it'll keep growing, and other patients it'll just stop growing, it'll just be there.
Okay. I have actually met one of your patients before, and she was explaining to me that she just kind of ignored it for a while, which I'm guessing a lot of people do. But it got so big, it actually impeded her swallowing. She was afraid that she was going to choke. Are these some typical symptoms of
somebody? Common symptoms. Those symptoms we call compressive symptoms, and they're usually, as a nodule grows, they push other structures out of the way because there needs to be a place for it to be in the neck.
Right.
And that can cause people to feel like they're choking or gagging or having difficulty with swallowing, or they can just see a big bulge on their neck.
Oh my gosh, well none of that sounds good at all, right?
So it's not normal.
No, but typically, until this radio frequency ablation, what were our options?
So we would typically take out those nodules and take out usually that whole side of the thyroid because that's the only safe way to do it. And so you'd have to remove half of the thyroid or even all the thyroid in some cases.
And nobody wants to do that, right? We need our thyroid.
Well, the thyroid has a main function of producing thyroid hormone.
Okay. So this new treatment that you've been doing now for the last, what,
4 years.
Okay, 4 years. It's a game changer for you, isn't it?
It is for the patients.
Especially.
Yes, for the patients. So we've been doing minimally invasive treatments on a lot of different things that we do from surgery, but this is the one that allows the patients to not undergo surgery at all.
Okay, and you can do it right here in your office.
Correct, under local anesthesia with the patient awake and talking.
Now, how do we know if we're a good candidate? Because, sometimes people let it go and it gets pretty big, right? How do we know if we could actually have the radiofrequency ablation?
So we want to make sure that the nodule is not cancer.
Okay.
And we also, the bigger they are, the harder it is to do. I mean, the longer it takes. But it doesn't make sense to do them on small nodules, but certainly the ones that are causing symptoms.
Okay. So here's a good example, though, of what can happen after the treatment. You said this is obviously a large nodule, but after the treatment, it shrinks down.
Right, within a very short time. Within 4 weeks, you have it almost 40% of the original size. Within 3 months, it's down to about 60% of the original size, 60% less than the original size.
That is amazing, right? What about medication? If you have to have a nodule, do you end up on medication for the rest of your life?
So if you remove half the thyroid with surgery, about 40% of those patients are going to probably end up on medications. But if you treat it with radiofrequency ablation, you have very low chances of requiring thyroid medicines after that treatment.
It's amazing. Wow. Well, thank you for introducing us to this treatment. I'm sure it's a game changer for you and obviously for anybody who has a nodule, right?
Yes.
All right. Good information. When you book your appointment, just mention Sonoran Living. You'll receive a complimentary neck ultrasound exam. That's a $350 value. Thyroid Nodule Treatment Center is located at 2320 North 3rd Street in Phoenix. Call 602-889-2923. Visit the website ThyroidNoduleTreatment.center.